Good morning, my dear friends. You are on a Dr. Y channel, and I'm Armen, Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia. And we continue to talk about your questions on the last exams, your tickets. So I see that number 5 and number 6 is about asthma. Let's do one lecture about asthma, so answering the questions of your exams. So, my friends, take papers, notes to make the notes. No pens and papers, no pencils, pens, up to you to make the notes. It's important to make the notes because I will talk about just key points. Uh-huh. So if the question will be about asthma. So what is asthma? No, of course, it's a bronchial asthma. We don't have another asthma. So asthma is disease. So if you find a question like this, so what is asthma? Asthma is a disease of a diffuse airway inflammation caused by a variety of triggering stimuli resulting in partially or completely reversible bronchoconstrictions. Symptoms and signs include dyspnea, chest tightness, cough, and wheezing. The diagnosis is based on history, physical examination, pulmonary function tests. Treatment involves controlling triggering factors and drug therapy, most commonly with inhaled beta 2 agonist in inhaled corticosteroids. Prognosis is quite good with treatment. So actually it's largely sufficient as this answer on the big exams. But who knows? For example, someone won't ask you who pretend to be someone, will ask you more questions. It will be not me, huh? But anyway, who knows? Huh? This is a jury, and anyone, all of members of the jury, got right to ask you another question. So be careful. Actually, okay, they can ask you to answer another question. So I find that in your tickets, pathogenesis, classification. No, clinics means signs and symptoms, clinical forms of bronchial asthma. Okay, let's answer this question. So once again, bronchial asthma is a chronic inflammatory disorder of the airways characterized by recurrent episodes of wheezing. This is wheezing, huh? Shortness of breath, no dyspnea, chest tightness, and coughing. The pathogenesis of asthma is quite complex and involves a combination of core genetics, environmental, and immune system factors. That's okay. So that's why, for example, question of pathogenesis in asthma, the airways become hyperactive, hyperreactive to a variety of stimuli, including allergens, irritants, and exercise. Between us, also in smoking, also. First hand, second hand doesn't matter. So allergens, irritants, and exercise. So this results in inflammation and swelling on the airways, which causes narrowing and obstruction of the air passages. The narrowing of the airways leads to difficulty breathing, wheezing, and coughing. Actually, very interesting. Its expiration is a problematic. That's why it's wheezing, and not inspiration, but expiration. Huh? That's why actually there are so patients with asthma has problem to talk because talking is the expiration process. We can talk in inspiration. For example, me, I'm talking in expiration phase, and these persons, patients got problem with talking. Okay. Classification. So classification. No, asthma can be classified based on the severity of the symptoms and the frequency of exacerbations. So how frequent they are. So severity and frequency. The most commonly used classification system is the Global Initiative for Asthma, GINA. So it's called GINA, GINA, which categorizes asthma into 4 levels of severity: intermittent, mild persistent, moderate persistent, and severe persistent. Clinic. So clinics, my friend, if you find questions like this, you understand, this is a classic medicine. Comes from Germany, German language. Clinic means signs and symptoms. So the signs and symptoms of asthma can vary depending on the severity of the condition. Common signs and symptoms include. Now, once again, we have to repeat. Wheezing. So wheezing is the whistling sound when breathing. It's actually the most prominent complaint. So not actually complaint, the sign, wheezing. Shortness of breath, difficulty of breathing or feeling out of breath. Out of breath. Chest tightness, a feeling of tightness or pressure in the chest. So we have to become very careful not to confuse with myocardial infarction or to angina. Now, actually, quite often they go together. Coughing. Coughing, a persistent cough, especially at night and early morning. So night's coughing, borrowing coughing. Borrowing not only for the person, but also to members of the family. Difficulty breathing, rapid breathing, shallow breathing, or gasping for air. Fatigue, French words, means tired. Fatigue, feeling tired or weak due to difficulty breathing. Rapid heartbeat, tachycardia. Rapid heartbeat or palpitations may occur during an asthma attack. What is next? Clinical forms? Yeah, clinical forms. Clinical forms. There are several clinical forms of asthma, including most common allergic asthma, triggered, obviously if it's allergic, but triggered by allergic such as dust mites, pollen, and pet dander. Exercise-induced asthma, triggered by physical exertion, activity, exercise. So-called occupational or professional asthma, caused by exposure to irritants or chemicals on the workplace, or for example minors, classic minors asthma. Nocturnal asthma, symptoms that occur primarily at night, predisposed to this is due to vagal hyperactivity. Steroid-resistant asthma, a type of asthma that does not respond well to steroid treatment. Proper diagnosis and management of asthma require a thorough evaluation by healthcare professional, means by doctors, including a detailed medical history, physical examinations, and pulmonary function tests. Treatment for asthma typically involves a combination of medications such as bronchodilators, anti-inflammatory agents, and avoidance of triggers, and of course, changing of lifestyle. Okay, so next, diagnostic, differential diagnostic, discriminating factors, differential diagnostic, treatment, prevention, complications of asthma, bronchial asthma. Let it be bronchial. So diagnosis of asthma is based on a combination, once again, of medical history, physical examination, and pulmonary function tests. A healthcare provider will ask questions about symptoms, triggers, medical history. So healthcare provider is you. So the physical examination may reveal wheezing during auscultation, coughing or other signs of respiratory distress. Pulmonary function tests such as spirometry can help to confirm the diagnosis by measuring lung function and airflow. So differential diagnosis, so we have to differentiate. Differential diagnosis involves distinguishing asthma from other respiratory conditions that may have similar symptoms, such as chronic obstructive pulmonary disease. Actually, chronic obstructive pulmonary disease and bronchial asthma are brother and sister. But anyway, no, you don't talk in this manner, of course. So we have to differentiate with COPD, chronic obstructive pulmonary disease, congestive heart failure, no, New York Heart Association classification, yeah, or bronchitis. Other conditions that may mimic asthma include vocal cord dysfunction. So actually, I've got a lecture about vocal cord dysfunction. Anxiety disorders, and GERD. GERD means gastroesophageal reflux disease. Reflux. No, GERD, huh? It's very often mimic, yeah. It's actually a good advice out of this question. Huh? The person with an unexplicable cough, check up his GERD. Highly likely that this person, remember my words, got also GERD. Reflux. Gastroesophageal reflux disease. Management. No, treatment management. Treatment. Treatment of asthma aims to control symptoms. Symptomatic management. Reduce the frequency, if it's possible, of course, of exacerbations and improve lung function. Treatment may include a combination of medications such as bronchodilators to relax the airways and reduce inflammation, and corticosteroids to reduce inflammation. But we have to understand, if we prescribe corticosteroids, is long life treatment, whole life. Other management treatment may include allergen immunotherapy, it depends, which can help to reduce the severity of allergic asthma. Of course, lifestyle changes is of paramount importance. And avoiding triggers and, of course, quit smoking. About smoking, I don't talk because actually, COPD and bronchial asthma. Remember that, my friends. Be careful of that. No quitting smoking, of course. No pulmonary problem. Smoking, it's. Prevention, preventing asthma exacerbations involves identifying triggers, if it's possible, and avoiding them whenever it's possible. It's very rare, it's quite impossible. But anyway, no, we don't answer it's impossible. Whenever possible. Common triggers include allergens, irritants, exercise, respiratory infection, smoking. Other preventive measures may include using air filters, maintaining good indoor air quality, and managing comorbidities such as GERD, gastroesophageal reflux disease, and sleep apnea. Actually, GERD and sleep apnea and asthma, like brothers and sisters. It's actually another heads of the same dragon. What next? Last is a complication. Complications of asthma can include severe asthma exacerbations, which can be life-threatening, my friends, and respiratory failure. Long-term uncontrolled asthma can also lead to airway remodeling, which can result in irreversible lung damage and the development of chronic obstructive pulmonary disease. And between us, beginning of chronic obstructive pulmonary disease is the problems of like asthma. It's essential to monitor and manage asthma symptoms to prevent complications. No, I think it's largely sufficient for your answer. Of course, there will be no time to answer in this manner. Just several minutes, maximum 1, 2, 3 minutes for your answer. But if you begin like I began, everything will be okay, I suppose. Good luck, my dear friends. So re-listening this video several times. It will be great to re-listening with your papers and notes. Why? Because when you're writing You remember the thing. It's very good for your memory. So going with my micromotorica. You have to, you listen, you write, and you will remember that in a very in better way. My good advice to make the notes. So see you in another lectures. God bless you, my dear friends. Don't forget to subscribe and follow the channel. Bye bye. I love you all. God bless you.